Okay, let's unpack this. Picture this. You're, snuggling with your furry friend, maybe giving him a good scratch. And then you notice a trickle, maybe even a rush of blood from their nose. A nosebleed.
Hmm.
It's one of those things that can be a little alarming, right? Whether it happens to us or our pets, and we might just think, oh, it's random.
Right, just a one-off.
But what if it's not so random? What if that seemingly simple nosebleed, what vets call epistaxis, is actually a really important signal, like something deeper going on?
Exactly. That's what we're diving into today.
We're using a pretty comprehensive source to explore this surprisingly complex topic in dogs and cats.
Yeah, what might seem like just a minor oh well moment could actually be, well, a key early warning sign about your pet's overall health.
So in this deep dive, we're going to look at what epistaxis really means.
The causes, which, wow, there's a long list.
Right.
How vets figure out the root cause and, the different ways they can treat it.
So whether you've seen this happen before or you're just, curious about keeping your animal healthy.
We want to give you some really useful insights, but, without getting totally lost in the medical jargon.
Absolutely. We're pulling out the crucial stuff you need to know. Our source really covers a whole range, from basic definitions to some pretty complex diagnostics and treatments.
It really does.
So let's start right at the beginning. What exactly is epistaxis when we say a dog or cat has it?
Well, simply put, it's bleeding from the nose. That's the basic definition.
Okay.
But the fascinating part really is the why. Why is it happening? Our source points to three main categories of underlying issues that can lead to it.
3 categories. Okay.
Yeah, think of it like this. The nosebleed is the symptom, right? And we need to figure out which of these 3 buckets the actual cause falls into.
Gotcha. 3 buckets. What are they?
Okay, so the first one is what we call coagulopathy.
Coagulopathy.
You think of this as a problem with the blood itself not being able to clot properly. Like the body's natural stop leak system isn't firing on all cylinders.
Okay. Makes sense. Clotting problems. What's number 2?
The second is local disease, or what they call space-occupying lesions. So these are issues happening right in the nasal passages, something physically there causing irritation or taking up space.
Right there in the nose. Got it. And the third?
And the third is vascular or systemic disease. So this means broader health issues, things affecting blood vessels maybe throughout the body or the body's systems more generally.
Ah, okay. So a nosebleed isn't just a nose issue then. It could be a sign that something else systemically is going on.
Exactly. It makes a lot of sense when you think about it.
And our source also mentions some specific body systems that can be affected when a pet has a nosebleed. That kind of shows how far-reaching this can be, right?
Yes, absolutely. It really highlights how interconnected everything is in the body. I mean, you might see obvious respiratory signs.
Like the bleeding itself or sneezing.
Yeah, bleeding, maybe more sneezing as the body tries to clear things out. But then, because pets often swallow the blood,
Oh, yeah.
it can show up in their digestive system. You might see melena.
Melena. I mean, that's the dark terry stool, right?
That's the one. That dark color is from digested blood. And then, obviously, because we're dealing with blood loss, those systems involved in making and regulating blood, the hemic lymphatic immune systems, they can get involved too.
Leading to things like anemia, low red blood cells.
Precisely. Anemia is definitely a possibility if the bleeding is significant or ongoing.
Okay, so a symptom that seems really localized can actually ripple outwards. Let's dig into that why a bit more, those 3 categories. Let's start with coagulopathy, the clotting issues.
Right. Coagulopathy. It's all about the blood just not clotting effectively. Our source breaks this down even further into 3 main subcategories.
Okay.
First up is thrombocytopenia. Now, platelets. Think of them as tiny construction workers in the blood. They rush to any damaged site and help plug the leak.
Little first responders.
Kinda, yeah. And thrombocytopenia just means there aren't enough of these little workers on the job. Low platelet count.
Okay, not enough platelets. And the source lists a lot of reasons why that might happen.
It really does. It's kind of amazing how many different things can knock down the platelet count. We're talking immune-mediated diseases.
Where the body attacks itself?
Exactly. The body's own immune system mistakenly targets the platelets. Sometimes we don't know why that's idiopathic, or it could be a reaction to a drug, or even, rarely, a reaction to certain vaccines, like MLV vaccines.
Wow.
Then you've got infectious diseases, big players here.
Yeah.
Things like ehrlichiosis, anaplasmosis, Rocky Mountain spotted fever, babesiosis, even stuff related to FLV or F5V in cats.
So infections are a major cause.
They definitely can be. Also, diseases affecting the bone marrow itself where blood cells are made.
Like cancer.
Yeah, neoplasia or cancer in the marrow. Or aplastic anemia, where the marrow just stops producing enough cells. Certain fungal, rickettsial, or viral infections that hit the marrow. Those two. And sometimes it's a perineoplastic disorder. That's where cancer elsewhere in the body misses with blood components indirectly. Or a really serious one is DIC,
DIC.
disseminated intravascular coagulation. It's a complex, dangerous condition where the body starts forming tiny clots everywhere, using up all the clotting factors and platelets, which paradoxically leads to, well, bleeding problems.
Oh, wow. That sounds really serious. Okay, that's a lot just for low platelets. What's the second subcategory under coagulopathy?
Right, the second one is thrombopathia.
Thrombopathia.
Yeah. So here, the number of platelets might actually be fine, normal count.
Okay.
But the platelets themselves aren't working correctly. They're like those construction workers who show up, but, I don't know, they forgot their tools or don't know how to use them. Platelet dysfunction.
Ah, so they're there but not doing the job.
Exactly. And this could be something a pet is born with congenital, like von Willebrand disease, which some people might have heard of.
Wait, I think Dobermans are known for that.
They are, yeah. That's a classic example. Or other inherited issues like thrombocythemia or thrombopathia. But it can also be acquired, meaning it develops later.
Caused by what?
Things like certain drugs, NSAIDs are a common one, or clopidogrel. High levels of certain blood proteins, hyperglobulinemia, which you might see with Ehrlichia again, or multiple myeloma. Kidney failure, leading to uremia, that buildup of waste products. Or, again, DIC can also cause platelet dysfunction.
So even with enough platelets, they might not function. Got it.
And the third subcategory,
That's coagulation factor defects. So this involves problems with specific proteins in the blood plasma that are crucial for the whole clotting cascade.
like missing ingredients in the recipe.
That's a great way to put it. Think of them as different essential steps or tools needed in a specific sequence to build that clot, that dam. If one tool is missing or broken, the whole process fails.
Okay. And can these be inherited too?
Yep. Congenital defects include things like hemophilia A, that's a factor VIII deficiency, or hemophilia B, which is factor IX. Less common, but they happen.
And acquired. Acquired causes are probably more common. A big one is poisoning with anticoagulant rodenticides.
Like rat bait.
Exactly, like warfarin-type baits. Also, severe liver disease is important because the liver makes most of those clotting factors. And, you guessed it, DIC can also mess with clotting factors.
Yeah, and DIC keeps popping up. Okay, so that covers coagulopathy, low platelets, platelets not working, or missing clotting factors. Let's move to bucket number 2. Local lesions. Problems right in the nose.
Right. These are often a bit more, well, geographically straightforward, though still potentially serious. Think about a foreign body.
Like a grass seed or something.
Exactly. Grass seeds, foxtails, bits of stick. Anything that gets inhaled and stuck up there. Trauma to the nose, obviously, or infections.
What kind of infections?
The source mentions fungal ones, specifically Aspergillosis, Cryptococcus, Rhinoscopy, also viral or bacterial infections. But interestingly, it notes that with those infections, you often see more of a bloody, pus-like discharge, mucopurulent discharge, rather than a sudden gush of pure blood.
Oh, that's a useful clue. Bloody and gunky might point more towards infection.
It can, yeah. It's a helpful distinction.
What else can go wrong locally?
Neoplasia cancer is a big one in the nasal passages. The source lists several types: adenocarcinoma, carcinoma chondrosarcoma, squamous cell carcinoma, fibrosarcoma, lymphoma too, even transmissible venereal tumor in some dogs.
Cancer in the nose. Okay.
And don't forget dental disease.
Really? How does that cause a nosebleed?
Well, if you get an oronasal fistula that's an actual hole between the mouth, usually from a bad tooth root, and the nasal cavity,
Oh, right.
that can definitely cause bleeding into the nose. Or even a severe tooth root abscess can sometimes erode right through the bone into the nasal passage.
Yikes. Okay, dental health matters here too. Anything else local?
Just one more mention is lymphoplasmacytic rhinitis. It's basically a chronic inflammation of the nasal lining.
Okay, quite a range of local nasal issues then. Now, the third category, vascular or systemic diseases, those broader body problems.
Exactly. And a major one here is hypertension, high blood pressure.
Just like in people.
Pretty much. High pressure can make those delicate nasal blood vessels more fragile, more prone to rupture. And in pets, hypertension is often secondary to something else.
Like what?
Kidney disease is a big one. Hyperthyroidism, especially in cats. Cushing's disease, which is hyperadrenocorticism, a specific adrenal tumor called a pheochromocytoma. Or sometimes, just like us, we don't find a specific cause that's idiopathic hypertension.
So high blood pressure is a key systemic cause. What else?
Another factor is hyperviscosity.
Hyperviscosity, thick blood.
You got it. Abnormally thick, syrupy blood that doesn't flow well. This can happen with that hyperglobulinemia we mentioned earlier, high protein levels, seen with things like multiple myeloma or ehrlichia, or with polycythemia, which is way too many red blood cells.
Okay, thick blood. Makes sense. That could cause issues.
And lastly, vasculitis. That's inflammation of the blood vessels themselves, makes them leaky or fragile.
What causes that?
It can be immune-mediated, the body attacking the vessels, or sometimes it's triggered by certain infections, particularly those tick-borne rickettsial diseases again.
It's almost overwhelming how many different paths lead back to a nosebleed.
It really is.
Yeah.
It underscores why just stopping the bleeding isn't enough.
Yeah.
You have to find that underlying reason.
Which brings us to risk factors. Our source touches on this. Are certain pets more likely to get nosebleeds for specific reasons?
Yes, and sometimes these risk factors give vets important clues right off the bat. For instance, the source mentions that younger to middle-aged female dogs, often small to medium breeds, seem more prone to that immune-mediated thrombocytopenia.
Interesting. Any other breed links?
Well, we mentioned Dobermans and von Willebrand disease.
Yeah.
German Shepherds and Rottweilers seem predisposed to Aspergillus, that fungal infection, and breeds with long noses.
Like greyhounds or collies.
Exactly, dolichocephalic breeds. They seem to have a higher risk of nasal cancers, unfortunately.
Mm-hmm.
And obviously, for the infectious causes, living in or traveling to areas where ticks and those diseases are common is a big risk factor, especially if the pet isn't on good preventatives.
Okay, so breed, age, sex, travel history, all potential clues. So if a pet comes in with a nosebleed, what's the diagnostic journey like? Sounds like some serious detective work.
It absolutely is. It has to be a really thorough, step-by-step process. Usually the first step is baseline blood work.
Like a CBC and chemistry panel.
Exactly. A complete blood count, or CBC, looks at red cells, white cells, platelets. The chemistry panel checks organ function, kidneys, liver, proteins, and often a urinalysis too.
And what can those tell you?
A surprising amount. The CBC might show anemia from blood loss, or crucially that low platelet count, thrombocytopenia. High white blood cells could suggest infection or inflammation, maybe even cancer. Really low counts across the board. Pancytopenia points towards bone marrow trouble. The chemistry might show high protein levels, like that hyperglobulinemia, or signs of kidney or liver issues that could cause hypertension or clotting factor problems. Even high BUN, with normal creatinine, might suggest they've swallowed a lot of blood.
Ah, because blood is protein.
Right, and the urinalysis might show blood, hinting at a clotting issue, or signs of kidney disease like dilute urine or protein, pointing towards potential hypertension.
So those first tests cast a really wide net. What if they don't give a clear answer? What next?
And then we need to dig deeper with more specific tests. If we suspect a clotting issue beyond just platelets, we run a coagulation profile. That checks the clotting factors.
Like for hemophilia or rat poison.
Exactly. If platelets seemed okay in number, but we suspect they aren't working right, thrombopathia, we might do platelet function testing. A common one is a buccal mucosal bleeding time. Test a small nick on the gum to see how long it bleeds, or specific tests for von Willebrand factor.
Okay, and the infections.
Specific tests for those. Blood tests for Ehrlichia, anaplasma, RMSF, Babesia, depending on location and risk factors. If we suspect nasal fungus like Aspergillus, there are blood tests, but the source ones they aren't always reliable can get false negatives.
Good to know.
And definitely in older cats with nosebleeds, checking thyroid hormone levels is key to rule out hyperthyroidism causing high blood pressure.
Right. What about actually seeing what's going on? Imaging.
Yeah, imaging is often crucial, especially if we suspect a local nasal problem or cancer spread. Chest x-rays, thoracic radiographs are common first.
To check the lungs.
Yeah, looking for metastasis, cancer spread. Then, if the nose itself is the prime suspect, we might do nasal x-rays. Needs anesthesia because they have to be perfectly still for specific views.
Can x-rays show much in the nose?
Sometimes. They can show bone destruction from cancer or bad fungal infections, maybe a dense foreign object, or signs of dental disease impacting the area, but they have limitations.
So better imaging.
Definitely CT scans or MRI. They give a much more detailed view inside the nasal cavity and surrounding structures, much more sensitive for finding tumors, inflammation, or subtle changes.
Makes sense. And sometimes you actually need to go in there, right? Like with a scope?
Absolutely.
Yeah.
Measuring blood pressure is also vital, especially if clotting and local issues seem less likely, or if there are other signs of hypertension.
Okay.
But yes, rhinoscopy is often next.
Using a little camera.
Exactly. A small scope goes into the nasal passages. Lets us look directly for Foreign bodies, tumors, inflammation, fungal plaques.
And you can do things while you're in there.
Yes. We can do a nasal lavage, flushing fluid through to collect samples for cytology or culture. And most importantly, we can take biopsies, tiny tissue samples of any suspicious area.
To send to the lab.
Right, for histopathology to diagnose cancer or specific inflammation types, and for culture to identify bacteria or fungi.
Okay. And what about that bone marrow issue you mentioned?
If the blood work showed the pancytopenia or other signs pointing to marrow problems, then a bone marrow aspirate or biopsy might be needed to see what's happening at the source of blood cell production.
Wow. Okay, it really is a comprehensive process. So once you finally nail down the cause, treatment must vary hugely.
Dramatically. Treatment isn't really for the epistaxis long term. It's entirely focused on fixing the underlying problem. Supportive care is key initially, of course.
Like fluids, if they lost a lot of blood?
Exactly. 4V fluids, keeping them calm and quiet. Maybe cool compresses on the nose to help constrict vessels. But the real treatment targets the cause.
Okay, so let's talk treatments for those categories. What about coagulopathies?
If there's severe anemia from blood loss due to a clotting defect, transfusions might be needed: whole blood, packed red cells, or plasma, depending on what's missing. Sometimes, cautiously, acetylpromazine might be used to lower blood pressure, but carefully. And obviously stop any offending drugs like NSAIDs.
Right, and for specific causes.
Very targeted. Immune-mediated thrombocytopenia usually needs immunosuppressants like prednisone. Infections need the right antibiotic or antiparasitic drug. Von Willebrands or hemophilia might need plasma or cryoprecipitate for the missing factors. Rodenticide poisoning. Vitamin K is the antidote. Hyperglobulinemia or polycythemia causing thick blood. Maybe plasmapheresis or phlebotomy. Liver disease or DIC. Treat the underlying cause aggressively and provide supportive care, often including plasma.
Okay, a tailored approach for each clotting issue. What about the local lesions in the nose?
If there's secondary bacterial infection, antibiotics are needed, ideally based on culture results. Fungal infections like Aspergillosis often get topical antifungals instilled directly into the nose, sometimes with oral meds too, especially for Cryptococcus. Rhinosporidiosis usually needs surgery, plus meds like dapsone, foreign body. Remove it, either via scope or surgery.
Makes sense. Remove the offending thing or treat the infection. And finally, those vascular or systemic diseases.
Again, manage the underlying condition.
Mm.
For hyperviscosity, from ehrlichia, myeloma, polycythemia, treat those diseases. Plasmapheresis might help directly too. Vasculitis, doxycycline for rickettsial causes, maybe prednisone if immune-mediated.
And a hypertension.
Find and treat the cause, kidney disease, thyroid, Cushing's, etc. And use blood pressure meds. Calcium channel blockers like amlodipine are common. ACE inhibitors, beta blockers, diuretics, often need a combination tailored to the cause. Pheochromocytoma might need specific drugs like phenoxybenzamine.
It's really clear how critical that diagnosis is because the treatments are so different. Our source also flags some contraindications, things to avoid.
Yes, definitely. Avoid drugs that worsen bleeding NSAIDs, heparin, clopidogrel, certain tranquilizers, and be very cautious with those topical antifungals if there's any chance the cribriform plate, that thin bone near the brain, is damaged. And just generally consider drug interactions and other health problems.
Right. So for you listening, what are the key takeaways if your pet has a nosebleed?
I think number one is recognizing serious signs: major weakness, collapse, really pale gums, heavy bleeding that's an emergency. Go straight to the vet. Understand the diagnosis once you get one and what the plan is. Follow-up is usually vital repeat blood tests, blood pressure checks, monitoring at home.
Prevention where possible too, right? Like keeping rat bait away, good dental care.
Absolutely. And just accept that the outlook, the prognosis, really depends entirely on what that underlying cause turns out to be. It varies hugely.
So wrapping this up, it's crystal clear. A nosebleed in your dog or cat. It's rarely just a simple thing.
Not at all.
It can be a really important clue pointing to a whole spectrum of issues: clotting problems, local nasal trouble, or big systemic diseases like hypertension or infections. A small sign with potentially complex roots.
Exactly. And hopefully by understanding the sheer range of possibilities and how vets approach it, you, the listener, feel more empowered. You can be a more informed advocate for your pet. Recognizing that complexity behind a common sign is key.
It really makes you think, doesn't it? If something like a nosebleed can have so many potential causes, what other little signs might our pets be showing us? What else might seem minor but actually hint at something bigger going on under the surface?
That's a great point.
Definitely something to keep in mind. Pay close attention and always talk to your vet if you're worried about anything, no matter how small it seems. Thanks so much for taking this deep dive with us today.